Hi, my name is Rosa Quinones. I'm a student nurse at TCC, and I'm doing my cultural competent care video based on the Vietnamese culture. So I would first like to talk about the religious beliefs of the Vietnamese in comparison to those of American beliefs. So the Vietnamese are a mixture of different religious. Most of them are Buddhists, but some of them do have some Confucianism beliefs and Catholicism beliefs. So Buddhism is based most on ideas of just that you're born, you grow, you fall ill, and eventually you die. So Buddhists are really open to death. Not that they're open to it or they welcome it, but they know that it's coming. So that's their view on life. It's just you're born and you eventually die. Confucianism is just a it's a way of living by a code of ethics, and it's really heavily on respecting your elders and respecting your ancestors. The Vietnamese have really close family values, and that includes having a lot of respect for the grandpas, grandmas, the older generation. This compared to the American culture, because I feel like in the American culture, not because of the Catholicism, most just because of the culture, they fear death a lot. They fear death a lot. We are not prepared for the inevitable. You don't know what's coming after life. So I feel like that's a big difference in both cultures, just because Vietnamese really know that death is coming, and they're just kind of ready for it. And Americans try to prolong life as much as they can, even if that means, not the best way of living life. They try to prolong it as much as they can. I feel like just because of that fear of not knowing what's next. I also wanted to talk about, the view of healthcare and also mental health in the Vietnamese compared to those of American. So the Vietnamese are very, not all, but a lot of are very open to Western medicine, and they're open to they know that an illness is there and they know that it needs to be treated, and it's just the difference is that they differ in the way in what they think causes that illness. For example, they believe kind of in the cold and the hot, which is a little similar to the yin and yang that the Chinese believe. So they believe, like, let's say you have diarrhea, they believe that a cold stomach is the cause of that diarrhea. Or if you have pimples on your face, that's due to like something hot. So your treatment is by treating it by the opposite thing. So if you have a cold stomach, you treat it with something hot, and if you have something hot like pimples, you treat it with something cold. So the treatments are like hot, that are considered hot, are like spices, coffee, or beef, and then what's considered cold is tea, fruits, ducks, seafood, stuff like that. So that's the way that they kind of treat themselves their own way before getting medical treatment. And I feel like Americans don't really have that thinking and the cause of illnesses. Like there's always a scientific cause to an illness and a scientific treatment for that illness, or treatment of symptoms for that illness. And the Vietnamese don't view it that way. They understand that some illnesses can be treated with Western medicine, but they also would rather do it their way in addition to that medicine. And then their view on mental health is just there's no such thing as mental health. Vietnamese really hide their emotions. They're really good at self-control. They try to keep their emotions to themselves. They avoid disagreement at all costs, and emotions are seen as a weakness. So I feel like talking about a mental health issue is talking about your feelings, talking about your emotions, and that's seen as a weakness in the Vietnamese community. So there's a certain word a Vietnamese word that they call psychiatrist, which in English translates to like the doctor of the insane, or the doctor of, you know, the crazy. That's what they call psychiatrists, because that's just how they view mental health. That if you go out and seek help for mental health illnesses, you're pretty much admitting that you're a crazy person. So that is why it's such a like a stigma. Mental health is such a stigma in the Vietnamese community. Like, no one will want to seek out for help, because no one wants to admit that they're crazy, even though, you know, you're not, you know, for seeking out mental health help. And I feel like as a nurse, that's really hard to really build that bond with a Vietnamese patient that really doesn't want to seek out the help even though they need it. It's just because it's just such a, you know, taboo in their culture. And then in comparison to American culture, you know, there's, like I said, there's always a scientific cost to illnesses. There's always a scientific cost to mental illnesses, and almost everybody seeks help for mental illnesses. You know, there's even kids, little kids now, you know, that with, you know, ADHD, autism, all that. Like, mental illnesses are known in all age groups here in the United States. In comparison to Vietnamese culture, that it's not even like, you know, considered a thing, especially with little kids having, you know, mental health disorders. So yeah, that's one of their views on healthcare and mental health. And I feel like also another one of their views is, you know, their traditional values. They're very family oriented, and loyalty to family is the most important thing. If you, as a nurse, if you're taking care of a Vietnamese patient, you know, you will always see a family member there, just because, you know, they take care of their own family, especially when it's elder. Like I said, the elders are respected the most in the Vietnamese community. So you can't really let, you know, your grandma, your grandpa, or your mom or your dad go to the hospital by themselves, because it's not you respecting them or taking care of them like they need to be. You know, so as a nurse, I feel like you need to be prepared to include the family in the, you know, care plan. A lot of the times, you know, it's not just about talking to the patient about the plan of care, but also talking to the entire family, updating the family. And, you know, sometimes a patient won't even agree to your plan of care unless their family agrees as well. So it's like you have more than one patient. So I feel like as a nurse dealing with Vietnamese patients with a lot of family, you need to try not convincing family, but, you know, try coming into an agreement with everybody, you know, for the better of the patient. So that's something that as a nurse you really need to, you know, take in mind to make sure you give the best care for your patient. In comparison to American culture, I personally, working at a hospital, I see this all the time, where there's a lot of older, you know, patients that are there alone. Not once do I see, you know, family calling, family coming and visiting. Patients are just left there alone. And not necessarily because Americans don't value family, just not all the time. Or just, you know, you see in American cultures, older people put in nursing homes more often than you see the Vietnamese cultures, Mexican cultures, any other culture. You know, that's just the norm for them. So that's something that, you know, to keep in mind, is that sometimes when you see older American people, sometimes they're alone in the hospital. It's just they have nobody to take care of them. They live in nursing homes, and sometimes the family won't even know that they're in the hospital. So yeah. So also I want to talk about, you know, I talked about the Vietnamese being open to treatment of diseases. You know, they're okay with, like, you know, medicine, pills, but they're not really open to surgeries. They'd rather do everything they can before they will do a surgery, just because it's so invasive, and they feel like, if they don't need it, why would they do it? But they also try something called like folk medicine, which they use in congruence with any of the Western medicine given. So a lot of these treatments are they have kind of like, well, they have different names. One of them is called Gao Joy, and is coin rubbing. So they use hot balm oil, and it leaves like petechiae on the chest and the back. And a lot of the times when a nurse sees this on a child, it's suspected as child abuse. Just because you see all these, petechia here, you just think the child's being hurt. So I think, being aware of the culture, being aware of their, the different treatments they do, can really help in, practically thinking that if a parent is abusing their child, when they're not. They're really just trying to heal them. They're just using their own way. They also do something called it's called Jiao, and it's cup suctioning. Something called Zhang, which is herbal steam fumigation. And they also have the belief that, let's say you have a bad liver, ingesting cow liver or any other animal liver will help strengthen your own liver. So that's their belief, and that's their own little way that, they'll help whatever illness they're going on, like their little treatments that they have, besides, just medicine. So I want to talk, now that we've talked about, the treatments comparing to American treatments, I want to talk about the Vietnamese healthcare compared to the healthcare in the U.S. and their view, Vietnamese view on autonomy compared to Americans. So here in America, everyone is, you have everyone is out for themselves in a way. It's a sense of individuality here. If you go to a hospital here, you get your treatment done first, regardless if you have money or not, and then you do a payment plan if you don't have any money afterwards, or if you don't have insurance. So they don't necessarily ask you for money right up then and there while you're dying, and then treat you. They'll treat you first and then deal with, how to pay afterwards. And in Vietnam, it's not that way. So the more money you have, the better treatment you get. And here in the U.S., not saying that the nurses are paid properly, but they're paid adequately comparing to other countries, as well as doctors. So and then they're properly staffed. And then here in the US, nurses and doctors aren't allowed to give the patient anything without patient consent. That individuality that comes in play with the whole American culture. You can't put anything in my body that I don't agree to myself. In comparison to the Vietnam culture, they have more sense of family. They're family oriented. It's not really a me, it's an us type of mindset. And their hospitals over there are underpaid, understaffed. So the service there is not the same as the service in the hospital, just because a lot of people don't want to be nurses. A lot of people don't want to be doctors, just because they're not getting paid properly and they're overworking them. So that's why a lot of people in Vietnam, due to lack of money, also won't really seek out healthcare, just because if they go anyway, they're going to be paying a lot of money and they're not going to get the adequate care that they need. So that's just how the healthcare system over there works. So I think, as a nurse, you really need to just keep all of these things in mind when dealing with a Vietnamese patient. You really need to make sure is the first thing I think you need to make sure is that language barrier. A lot of Vietnamese people, a lot of them speak English, but a lot of them that recently came from Vietnam do not. And if they do speak English, they have a heavier accent, which is harder to understand. So I feel like your first thing as a nurse is asking them if they'd like a translator. Even though they can speak some English, they may not be comfortable just speaking it to you, or they may not be understanding everything you're saying. So that's not the best way for you to you know, talk to a patient, communicate with a patient, if you're not even knowing that they're understanding everything you're saying. So that's the first thing you need to do. And then you also need to ask, like, would you like me to update your family? Would you like me to do this and this? You need to ask them if they're okay with, the treatment plan that they're doing, or, like, if they be open-minded about things. If they, don't want to do the treatment that you want and they have their own personal treatment, obviously always suggest the treatment that you're going for, but always be respectful of their own treatment ideas and everything that they do based on their culture. Don't be judgmental of somebody else just because their beliefs don't fit, or that's not the right way to do it. If they have their own way of doing things, as a nurse, you need to respect that option. You've suggested what you need, but you can't force them to do things your way. So you always have to just keep that in mind. And then I think it's really hard to give mental health advice to, or try seeking for Vietnamese people to get mental health treatments just because of their view on mental health. But just understand how much of a stigma it is. And always just try your best to communicate with them. Try to talk to them, try to build that relationship with them, but don't be surprised when a lot of that times they won't go through with getting the help they need. So just understand that might happen sometimes, but and don't force yourself upon them. Just do the best you can, and if the patient themselves doesn't want to, then there's you've done the best that you can. So yeah, being able to just like I said, communicate with your patient, take away that language barrier, be open-minded, talk about treatment options, even though if they're not okay with it, talk about what you can do, what they want to do. And I think that's the best way to give the best care you can to a patient that's from a different culture, and making sure that your patient gets the best safe nursing care that they can get.